Would you like a second opinion on your diagnosis? Please send your analysis and medical history to Visit at QS24.tv, and our Chief of Medicine, Miss Dr. Wiechel, will analyse them for free and anonymous in our new series, Visit. For more information, visit QS24.tv.
A warm welcome to all our viewers to our series Natural Medicine. Today I'd like to raise a topic that Dr. Dietrich Linghart once threw into the room and said I should do an investigation whether or not I have Pyroluria. After a chelation discharge, he found that a lot of minerals in my body are being lost, which corroborates this suspicion. I've no idea what a Pyroluria is. There was not enough airtime for it, but I have an expert here. The manager of the Swiss Mountain Clinic. She came to us here today, Dr. Petra Wiechel. A warm welcome, dear Petra.
Thank you.
For you, this Pyroluria is not an unknown thing.
No, this is a form of basic diagnosis that I do, because around 15% of the population suffer from such mostly unrecognized metabolic disorder. It has two major clinical differences. One is that, of course, the people who suffer from pyroluria are also really intelligent, super intelligent people, but who are often no longer able to structure their lives well. So Einstein had pyroluria, Darwin, Charles Dickens were affected by pyroluria, and these are people who have a small deficit in the pyrrole metabolism, in the heme metabolism in the blood, that they simply excrete zinc and vitamin B6 in the urine. That means it doesn't become noticeable when I'm little.
But I don't have a zinc deficiency. I have a lot from what I've seen, but I lose it through chelation discharge.
Well, now you have to look. Either you have pyroluria or you don't know yet. It's just a thought, because we keep observing that people get sick. Sometimes they get sick very early, and we ask ourselves, what condition a stress actually encountered? And it varies from person to person, and with pyroluria, it is much more common than we think. For example, with autistic children, 70% are pyroluria children. Or if they have ADHD, 80% of them are pyroluria children. Because these children or people lose zinc and vitamin B6 in their urine every day. And that's actually important when the children develop allergies in childhood, or, for example, become so hyperactive that they actually cannot concentrate that well. They are super smart, they are highly mentally active, but they find it difficult to calm down, and they often quickly get classified as hyperactive and are treated with Ritalin. And that's really not fair to the children. I had a pair of sisters at the clinic, two young girls. When one went to university, when performance was really required, she developed a psychosis, and the other sister, schizophrenia. No, it was just a pyroluria family. It was like a nest. It turned out also the father had it. The father had just developed completely different diseases because of these two shortcomings. And both girls are now totally healthy. And that was all well handled. But of course you have to substitute here.
It's easy when you know.
Of course it's easy, otherwise it can cause getting sick. For example, having a chronic viral infection again and again. Getting an infection, triggering an autoimmune disease. Zinc is an all-rounder in the cell. In other words, nothing works in the cell without zinc. Whether you develop a reactivated Epstein-Barr stress or develop a zoster, a herpes virus, is partly a zinc problem. And this intracellular immune system is zinc dependent in its economy. The mitochondria are also dependent on an optimal zinc level. Zinc is a trace element that is responsible for 400 enzymes. This means that the reaction cannot go from A to B if there is not enough zinc. For example, a lot of people have a weak diamine oxidase. They cannot break down histamine and repeatedly develop itching, allergies, or a racing heart after eating, or a headache, neurological symptoms. They cannot produce this diamine oxidase sufficiently because it is zinc and vitamin B6 dependent, that it can rebuild itself again and again. And as I said, these Pyroluria patients discharge this zinc every day. And now, of course, the question arises, is my need increased? Because if I have a toxic exposure now, then of course I need a lot more of substance to invest in my detox now. The liver is also zinc dependent in its detoxification capacity. Zinc is also responsible for all regeneration of the nails, the hair, my skin. That is zinc dependent. A skin disease must always be seen in connection with a zinc deficiency, and you cannot measure zinc in normal blood and serum, but must always measure it in whole blood and intracellularly, because 70% of the zinc is found in the cell, not outside the cell. Sometimes you have a normal zinc level, but if you look then how it is measured, then this zinc level is irrelevant. We also very often use a heavy metal tester that measures zinc via the connective tissue. And I saw Dietrich Klinghardt's device when I visited him in Seattle, and then he said, "You don't have this test, this is a Swiss device." I wasn't home yet when I had it too. But he told me that he had already measured there for half a year, what he then measured in the blood or urine. And that's why it was so very clear to me that I would, of course, integrate this test method. And there we measure in the connective tissue. And sometimes I see a very high zinc level in the connective tissue. And then people might think, well, I then have enough. No, the zinc has to get in through the receptor. If the receptor is blocked with mercury or aluminium, however, zinc does not get in there. Now, when I have pyroluria, I might still have the discharge, and now I might take zinc anyway, and it stays in the connective tissue. It cannot be taken intracellularly. This is why it is so important to understand why zinc accumulates. With pyroluria, you bring it out faster, but the other patient, they cannot insert it intracellularly. Zinc is responsible for activating T lymphocytes. This is the very important immune cell, which in turn activates the natural killer cells. And the B lymphocytes, so in the tumour defence, in the viral defence, the activation does not take place at all without zinc, the development into such cells. So zinc, as I said, is the all-rounder, and I'm really pretty scared how few people take zinc. And you have to know that zinc is not well absorbed either, so from what you take, 30% is only absorbed through the intestinal mucosa. That means there is always the issue that you're only allowed to produce 15 milligrams in one tablet. Every zinc preparation that is higher than 15 milligrams must be prescribed, but my dosage, we always test it out, sometimes goes to 45, 60, 70 to 100 milligrams temporarily, when, of course, I have seen exactly what is the cause. And zinc deficiency then, of course, also causes it on many levels, and pyroluria patients often have it. Autoimmune disease, psoriasis, skin diseases, allergies, neurodermatitis, asthma. These are all things that may have to do with this, but actually it is the loss of zinc. And the other is the vitamin B6. Vitamin B6 is the most important nerve vitamin, and thus, of course, also for the cerebral development, for intellectual development, for cognitive development. vitamin B6 is built into a large number of enzymes. I have already mentioned diamine oxidase. That means also here, a lot of people with B6 deficiency have headaches. It is the B vitamin for migraines. And so the composition is always like that. There is a preparation that actually contains everything.
Zinc and B6?
Yes, but a loss of vitamin B6, for example, also causes selenium and manganese and magnesium to go into a deficit.
I also lose those a lot, according to my results.
Exactly, yes. But as I said, it is these influences, again, these minerals that need each other for each other, and then get into the deficit situation too. And you have to build it up well and for a long time with the active vitamin B6 and with this combination. I would never do a discharge on someone and I don't know if they have pyroluria.
That surprised me too. I mean, I've never heard that before, only from Klinghardt. That's why he told me to go to you, and I'm doing it now. I'll also do a liver detox now. Are we doing a pyroluria test there too?
Yes, we will do that for sure, because then I always want to look at it. Because patients who come, I already know a little about their concerns beforehand. And I always discuss that at the start. Let's tackle these and things, because certain things you always have to check without going too much into depth now. But certain things are vital for the process of such a liver detox, I think.
I think I have to take the camera with me. That would be interesting too. Now, another question. You said earlier that killer cell production is always related to zinc deficiency. Do oncologists know that?
I don't know if they know. They don't actually know that before they even start chemotherapy. They should know how well a patient can detoxify, because when they're working with a chemotherapy drug and do not have a good detox, just maybe because they are deficient in selenium, then they will load the liver with a toxin that does not detoxify from A to B. An even more toxic intermediate product is created in the liver, and they cannot make it through the kidneys so that it is discharged. That is ultimate responsibility when I decide on such a therapy. I have to clarify that this person can also detoxify.
It's not done, is it?
I don't want to judge that either, but I think that has something to do with responsibility. And I wonder why people always have liver metastasis and you think it's from the tumour. Is it perhaps also due to a toxicity that the liver can no longer compensate for? No, they don't know. And I could well imagine that somehow a process has to take place there, that we get our patients through such a therapy, which then also has a success. And don't look at them one-sidedly and focus exclusively on something bad, because it's not bad and it's never bad because it originated in me. It's only got a self-dynamic. I've been looking for another name for this disease for years. I think cancer is not a pretty name. It should sound much, much warmer, because at the beginning it can only be understood. And if it is understood, then we will treat it differently. But we have acquired a thinking that we say, we have to destroy this process as soon as possible.
We'll shoot it with everything we have.
And destroy the friend at the same time, because it is in the friend. It is not an enemy in which it has grown. That remains a friend. And we destroy everything with it. So that's something where I think maybe it has to be the patient's question. How can I best keep this balance when we choose therapy like that? How good is my body at all? Is my body capable? That's it. Is my body able to compensate for this therapy? Not to mention that, of course, a sensitivity test is never done in advance. Is this my medication, or does it have a higher side effect than benefit? Tumour markers go up and the next one is taken. Now, I can know in advance how well this drug works against this tumour disease if it should be taken, to keep very simple.
The wife of a friend of mine has had many cerebral hemorrhages, and they found out that she somehow has a hole in her heart up here, and now they have to operate on her and close this hole. I only asked my friend the question, did they also clarify why this hole came about in the first place? I mean, it can come back. And he says, no question, nothing at all. Then I say, well, go see those guys in the Swiss Mountain Clinic. Let them clarify it. There must be a reason.
So the number of cerebral hemorrhages has gone up immensely since we upgraded with all of these radio masks.
Oh no, really? Does that go here too?
Of course.
We don't know what we're doing here either. Okay. And did you find a connection to the heart? Somehow a hole? Have you already established that this connection exists?
Yes, and above all, you always have to look much, much deeper. I can't even go into depth now.
I said you should put all the data together.
It's always looking at the big picture in order to simply understand it. There's a hole here and there's a bleeding. So for a long time, it's not been here the way it should be. So it is difficult for me to always give the recipe for anything, because it cannot exist at all. Everyone is so individual, and different things also contribute to it. Everybody has its weak point somewhere, and it is precisely at this weak point that disease shows itself.
Let's go back to the Pyroluria, please. How can the viewer at home actually notice that they might suspect that they have Pyroluria?
Yes, so there are different laboratories who offer this check for a Pyroluria. There is a Dutch laboratory where you have to send a sample. Of a 24-hour urine. You can do that all by yourself. There is also the Ganzimann laboratory in Germany, for example, that does that, a morning urine. It is only important that you then know not to take a B complex preparation 1 week in advance. And also no zinc, please. And then just take a sample of the morning urine. It has to be a special tube, which you can request as a consumer. And you can send this urine away and then get a result. And of course, you can act immediately with this result.
My question was more about, how do they know that they could have it?
Well, by rethinking all of the things that I've said now. By realising that they sometimes cannot mentally concentrate, that they cannot sleep well, that they may be mathematically great in life, but they also cannot remember vocabulary, for example. They have a bit of problems with their short-term memory. By having skin diseases, the nails are brittle. If zinc is missing, you have tiny dots on your nails. And you sometimes have grooves across. After a substitution, they are gone again after 4 to 5 months. By having a headache and not being able to classify it, I've already said skin problems, autoimmune diseases, allergies, food intolerance, abdominal problems. So if you read a little about it, I have a nice article in the clinic about this Pyroluria. I always give it to every patient. It is also available. You can also request it if you want. But these are all important things. Or Pyroluria, there are now so many books. Kyra Hoffman wrote a very nice book about Pyroluria and a disorder in pyrrole metabolism. And as I said, a metabolic disorder, which is ultimately the cause, that in the end, it is called allergy, it is called food allergy, it is called migraine. Then it is called psoriasis, because an autoimmune disease has already developed, but that was overlooked. I don't really want to overlook that in order to always integrate this into a treatment, which then gives me the prerequisite that I can take the next step.
Great. So I'm also looking forward to our new series, Visite, in biological medicine, which we start tomorrow. For you, dear viewers, where a new episode is always shown on Sunday evenings. And it's really about these cases out of life, what viewers experience at home.
Yes, it may not even go very deep, because then there is not so much time, but simply questions that you have on your mind, which perhaps you can simply help you, when you answer them, to question them more consciously, to see it that way, and for God's sake, not take anything for granted. The body is so grateful for all help at all times. And it does it. It's amazing. It does it. We just have to trust it and understand it. Then it's really delightful what you can see.
Thank you very much. Always a blessing for me to be able to speak to you. I repeat myself, but there are always different viewers here. And that's why it's also important to say, because I just keep learning. You can't just work with the club. You have to learn to understand the body and to work on this level, that it's in balance.
Sure, and give the time, give patience.
Yep, and the condition you have now is not bad. It's great and actually the most sensible answer, due to the circumstances that led to it. You're right, the word cancer has to go, because that's a totally negative association, and that causes a lot up here.
Yes, and above all, if we could give it a new name, that at the beginning we want to understand it as something, how it arises. For 70 years we've only dealt with how we can destroy it. But then I think you would be able to find peace and quiet from the first hour, and also be able to take some responsibility and really play a part of it, because there is an immense amount of work to be done when such a diagnosis comes, and there is so much agitation and pressure and stress that in these consultations I'm happy to be there for a second opinion. But actually my most important task is to first ground and say, now please stay calm. Now we ask first, how can this happen? And then it is important in the future anyway that my body can do what it was able to do for 30 or 40 years before, because it has the best anti-tumour programme itself. It happens every day.
Yeah, of course. And if you think about it, for the past 70 years we've actually been suffering from chronic diseases, and academic medicine didn't get very far either.
Well, further in the direction that they increase. So 70% are quantified as chronic, and I wonder what we do about it.
So it's about time to really introduce biological medicine, and to ask yourself why it could come to this point. These are the right questions.
I think so too, and if you don't give any answers, you can't be in the game. You can only say thank you, then I have to look further. But you should never take anything for granted. But try to get more involved. That really takes you further. I can really see that.
To whom is it useful? I sometimes ask myself when I hear and read business news. And here it's exactly the same thing. You have to ask, why do I have that? And when I get the answer and not just the reply, because it is, well, then I'm on the right track. Thank you very much, dear Petra. And to you, dear viewers, thank you for watching today. I wish you all the best. See you next time.